Healthwise FAQ.
All this week on Healthwise FAQ, we're casting the light on the Ebola virus outbreak that is reaching new heights, really, in terms of its spread in the West African nations. The World Health Organization has said more than 1,700 people have been infected. The latest news coming out today, this Tuesday, is that 8 Chinese medical workers who were treating patients are now suffering from the deadly Ebola virus. They've been placed in quarantine in Sierra Leone. What's come out now, news updates, is that the Chinese ambassador has said that these 6 Chinese doctors and 1 nurse, as well as 5 local nurses, had treated an Ebola patient at the hospital known as the Jui Hospital. That patient had later died of the Ebola virus. The spread continues. Current estimates say that Nigeria has its 10th confirmed cases, that Sierra Leone is the worst hit of the nations, with about 298 deaths confirmed so far. Joining us on the series once more, infectious disease specialist Dr. Leong from the Rofi Clinic at Mount Elizabeth Novena. Dr. Leong, we know that the WHO has come out to label this, an international health emergency. And Margaret Chan, the Director General of the WHO, has even called it the largest, most severe and most complex outbreak in the nearly 4-decade history of this disease. How serious is it that the WHO has actually come forward to call it an international health emergency? What does that mean?
It means that Margaret Chan is forward-looking. This is an emergency that will hit the world if we are not careful. You're talking about West Africa, where the resources are some of the poorest, and the only way to prevent the transmission is actually good infection control practices. That means preventing the germ from coming to us, wearing gloves, wearing gowns, wearing protective gear and things. You can, by labeling it as an international emergency, we are going to get aid going down to West Africa to help them. And the honest truth is this: if we don't nip the problem back in West Africa, it will spread through the world.
And as you said in our last edition, as interconnected as we are, with travel being as connected as we are, this is a very real issue. Dr. Leong, I wonder, we've heard about so-called experimental treatments being used on certain patients that were flown back to the United States. These are not available on the market. These are experimental treatments. What do we know about such experimental treatments? Is that something that we will see more of on the horizon?
Yes, we will. This is an unprecedented call for a deadly virus with no treatment availability. You will see drugs which have never been approved, never shown good efficacy, come into the market to try. In fact, during the days of SARS, similar drugs came up, but the good thing was SARS died before the drugs were really used effectively. We'll see more and more of these drugs and more experimental therapies because the risk of dying is so high for this illness.
Is it true that comparatively little is known about the issue of Ebola, in spite of the fact that it's been around as long as it has?
There is some things known about it, as in what predicts mortality, what kills and what doesn't. We do know that how it's transmitted, but in terms of control, in terms of treatment, we know very little. That's due to a few reasons. Number one, not many centers want to research on it. You need to have good facilities, high precaution facilities to do work on it. Number two, most researchers would think twice about doing a deadly virus because if there was an accident, the person can fall sick. Number three, the government would have complete watch over the situation so that no virus leaks out. So the circumstances allowing the research of virus is extremely remote.
We hear in today's news that 8 Chinese medical workers who treated patients suffering from Ebola have been placed in quarantine in Sierra Leone. So once again, a reminder that it is the healthcare worker that is really on the front line here.
Absolutely. And you'll notice a similar pattern between this and SARS. The outbreaks and where the infection occurs will be the hospitals. And the hospitals will be the sentinel centers. And if anything, the hospitals must be ready to accept a case of Ebola that comes in unexpectedly, unannounced.
What we need, as you described, is this influx of better care practices and the right information about how to deal and how to treat with this situation, this outbreak, really. Are we seeing that starting to trickle into the West African countries?
I don't think it's fast enough. We see aid going in. We see CDC Atlanta sending people in. And I'm very sure WHO is trying to coordinate more specialists to go down to the field. But it's also a situation where you need a lot of good medical supplies, which is a luxury in West Africa. We're talking about full protective gown. We're talking about gloves. We're talking about eye shields and head covers. And to work in that situation is extremely taxing, and to work in hot, humid West Africa with all this gown is literally challenging. So, if anything, more aid financially, as well as in equipment and supplies, as well as manpower, has to float into West Africa to make a difference for them. And the response, the global response to this epidemic will determine if this outbreak extends globally.
Our infectious disease specialist, Dr. Leong Ho Nam from the Rofi Clinic at Mount Elizabeth Novena, giving us a clearer picture of what is happening with this Ebola outbreak. That does it for today's Healthwise FAQ. I'm Daniel Martin.
Healthwise FAQ.